The goal of CHRISTUS Cabrini's inpatient physical rehabilitation hospital is to get you back home or back to work as soon as possible following an illness or accident.
We're basically trying to emulate a home environment, get them back into clothing that they're going to wear at the house, and sort of reproduce the day that they're going to have the first day they actually leave the hospital. As far as the importance of timing, the most important thing is that the application of the therapy is timed correctly for the patient. So the urgency issue is not necessarily always there. There's a time and place for everything, including the application of those therapies.
The unit, located on the second floor of the hospital, provides a full range of rehabilitation services.
We have a 25-bed rehabilitation unit or section of the hospital, and patients on inpatient rehabilitation have transitioned from other hospitals or from other floors in Cabrini Hospital to this second floor site. They're residents there, they spend the night there, they have a nursing crew 24/7 that takes care of them, and technical partners that assist with mobilizing them in the morning, and then respiratory therapists, physical therapists, occupational therapists, speech therapists, dietitians, all of the normal hospital ancillary staff are available to them just as if they were on an acute care floor in the hospital. Well, we see a variety of diagnoses on the rehabilitation unit. We have, the stereotypical rehab patient here would probably be a stroke patient, but we take care of traumas, falls, fractures, post-operative orthopedic, spine injuries, neurologic diseases that folks have heard of, like Parkinson's disease or Guillain-Barré syndrome. And then a big portion of the rehabilitation patients are those individuals who have been hospitalized for more routine diagnoses, things like pneumonias or congestive heart failure or coronary artery disease. And they've simply been hospitalized long enough that they've become weakened either by the disease process or the length of their hospital stay that they can't make that leap or transition to the house. And so that's another subset of patients that we would see on rehabilitation.
The unit's healthcare team also provides outpatient physical rehabilitation services. For more information about CHRISTUS Cabrini's inpatient physical rehabilitation hospital or outpatient services,
you can call Cabrini Hospital and ask for the rehabilitation unit as a start. And there are folks there who can field those calls and pass them on to the appropriate personnel.
The Medical Minute is brought to you in part by CHRISTUS St. Francis Cabrini Hospital.